All right, so I'm here at the Mental Health Service Conference 2017 with Mike Slade, who's Professor of Mental Health Recovery and Social Inclusion at the University of Nottingham. So he's given the keynote this morning, and I'm particularly interested in asking you a bit about social inclusion, which you sort of touched on, but didn't get into too much detail about. So we're seeing a few debates about these sorts of issues here at the moment with marriage equality and changing Australia Day to recognise, Indigenous peoples. What role does social inclusion have in the mental health space, and how important is it?
I think it's essentially a marker of full citizenship. So to some extent, I think the issue is not having kind of special places where people living with mental health problems go and live or work or play, just being part of the community. And social inclusion, I think, is sometimes said to be the simple stuff in life: having someone to love, something to do, somewhere to live, and something to hope for. And in a sense, that transcends any kind of diagnosis or mental health issue. That's just the general thing that us citizens look for in the societies we inhabit. So I guess the kind of social inclusion agenda is about saying there's stuff around treatments and supports and recovery planning and all of the sort of things to help people deal with internal psychological difficulties and difficult emotions. But then there's a hard reality of do people have access to, someone to have sex with, someone to be a brother to, someone to go to the pub with, just the normal stuff that keeps many of us going. And in that sense, it's, I guess, about the agenda of reducing to the point of zero the discrimination that people experience, either that they anticipate or actually experience in our societies.
And in terms of, you talked about a paradigm shift this morning, we're on the precipice of one you hope or you believe. Could you talk a little bit about that?
Yeah, sure. So the view is that essentially the old model, the kind of biomedical model, has somewhat just dried up. It's kind of reached the end of its sell-by date, and we're kind of carrying on doing the same things we were doing 10, 20, 30 years ago. And there's a whole new source of innovation which is premised on a different source of expertise, that of lived experience. And that's the big difference, and that's the thing that is, I think, going to create and is creating globally a tipping point. To say, actually, what we used to think the person who knows is the clinician, and we're now learning the person who knows more and more is the individual themselves. And that's a whole different worldview. It means that, for example, the job of the worker is no longer to fix the person, but to support self-righting capacities that exist already in the individual. And that requires maybe a whole new skill set. It requires different ways of working that empower at every opportunity rather than protect at every opportunity. It has a different kind of positioning of expertise of the clinician, as instead of being the duty of care that it must be applied, it becomes a resource for the individual to use in their recovery journey. So it's a real game changer, this sort of new understanding that's emerging, which is bannered as recovery, but actually is to some extent a social justice movement.
And so what is recovery? I mean, there's been a lot of talk about this morning, the recovery model, and that seems to be the dominant sort of paradigm that we're thinking about this through now.
Yeah, I think when people who talk about the recovery model, they're probably talking from a clinical perspective, trying to make sense of a new way of thinking, and clinicians use terms like models to explain that. I don't see it that way. I think I would never talk about the recovery model. I might talk about the recovery movement, because I think it is actually more aligned with human rights and social justice than it is the latest thing for the clinical system to do. And I suspect that what will end up is a mental health system that has some input to people's lives at some points of particular difficulty, but will more and more look to supporting the individual to create their own solutions, their own recovery journey, and recognising that may be partly or entirely outside of the mental health system. So there's a real kind of changed orientation between the individual and the system. And I guess a recovery movement is opening up space that, for example, some people may not need treatment. Even though a clinician thinks, well, they have symptoms and so they need treatment, actually they have a fine way of getting on with life, thanks very much, and living with those experiences in a way that doesn't bring them into contact with the mental health system.
Yeah, I mean, you sort of touched on that you spoke about mental illness being, a limiting thing to talk about. Could you expand on that?
Yeah, sure. It's a particular metaphor that people have a set of experiences and we label those as an illness, and that creates all sorts of assumptions that we should get the label accurate. So diagnosis is very important, that the solution is effective treatment, so we need a clinician, an expert to provide that treatment. It creates all kinds of embedded assumptions within that narrative, and as we listen to what people say and find out about the journeys of recovery that people undergo, what we find is some people, for example, understand their experiences as a spiritual crisis, and then viewing it as an illness is a constant kind of mismatch, or other people as an existential or life events crisis, and so these narratives that should be expanding and opening up possibilities of new solutions, if we impose a narrative, an explanatory model that this is a mental illness, we inadvertently close down the options for people to find a way forward in their life, and that can't be to anyone's advantage.
Thanks very much, really appreciate your time.